Dr. Vytenis Andriukaitis, and he's worked as a Commissioner of Health for the EU, which aims to tackle vaccine hesitancy and improve coordination on vaccine procurement. And Dr. Andriukaitis joins me now from Vilnius in Lithuania. Thanks so much for coming on the programme. Now, you've been a very vocal advocate for vaccines. As the world's attention focuses now on COVID-19, what are your biggest concerns regarding child vaccination programmes?
I fully agree with you. Today we are facing a new big challenge because in many countries you can see that the governments are not capable to continue vaccination program. It is serious problem. It is very dangerous situation. We are living now in one global village around the globe. In time of globalization and interconnectivity, very high level of interconnectivity, to transmit virus from one continent to another is so simple, like we see situation with pandemic, with COVID pandemic. And of course, COVID is not alone. We are staying together with different types of virus, measles, rubella, polio, all issues around us, and we need to encourage countries and to continue to be very active and to continue very, permanent vaccination of especially children.
And which countries are the most at risk? As you said, viruses can move from continent to continent, as we have all seen and we're living through right now.
You know, you can see that we had last year we had a big outbreak of measles in European Union, and of course in European continent, or even the region as a whole. Of course, also speaking about polio, we know that we have neighboring countries in Middle East, and Yemen is not so far from us, and we need to understand that polio can create a lot of challenges. It doesn't matter that we have countries which just proclaim that they are polio-free, but we are not secure if we have some outbreaks in different places. And around European Union, we see a lot of countries where we can assist to do more and help them to continue their work in vaccination and to guarantee access to vaccination.
And do you think that people, healthcare facilities in countries have forgotten? You mentioned Europe, just how deadly polio and measles can be?
No doubt. You know, nobody is secure in the situation because please keep in mind that vaccination was done long year ago, and not always it was properly implemented. Not always where vaccination calendars were built on science, and some people are not protected from reinfection. And we see, we saw a situation with vaccination, with polio vaccination in Ukraine a few years ago, and it was also alarming situation. We reacted immediately to help Ukraine to address those issues with revaccinated children. And now the same situation speaking with around EU, in the Middle East especially.
And Dr. Vytenis, as a former EU Commissioner advisor there, what would you be advising EU governments, American governments, and not just Middle East countries that we've looked at here with regards to child vaccination programs?
As you know, we organized Global Summit on Vaccination last September. We invited all actors around the globe, all countries, and we proposed some 10 steps memorandum speaking about possibility to continue vaccination programs and to harmonize calendars in EU, within member states in the EU, and also between EU and neighboring countries and globally, because it is very important to know that we have a lot of people working in different countries in the EU, more than 30 million. And when you see differences in vaccination calendars, you can, put your children in so-called vaccination calendar gap, where in one country is a little bit early, in another too late. In one country, vaccination was used with some types of vaccines, in another different, and it creates a lot of problems. And globally, the same situation. We need to now to keep high on the agenda vaccination issues and encourage all countries globally to harmonize their vaccination calendars and to understand that it is so necessary, because now we are facing a lot of global threats.
Thank you so much for explaining that so well for us. Dr. Vytenis Andriukaitis, it's been a pleasure to speak to you on TRT World. Thank you.